Nursing Interview Question 7. Question 1. A patient with pneumonia has increasing oxygen demand despite 4 liters nasal cannula. What next? Patient is showing signs of worsening respiratory failure and needs prompt escalation of care to avoid further deterioration. My immediate actions would be to assess, which includes check for increased work of breathing, accessory muscle use, tachypnea, mental status changes, and vital signs, SpO2, heart rate. Next action would be to notify the provider immediately. The patient may need a rapid response team if they are distressed. I would escalate oxygen delivery per protocol, like switch to a higher flow device. Replace the 4-liter nasal cannula with a device capable of higher FiO2. For example, simple face mask that delivers oxygen at rate of 5 to 10 liters per minute, or non-rebreather mask, NRM, 10 to 15 liters per minute, if severe or rapid decline. Then I would reassess breath sounds and anticipate ABGs or higher level of care if worsening continues. Question 2. You have a patient with chest pain. Troponin results are pending. What do you do? I would assess for pain characteristics, obtain vital signs, blood pressure, heart rate, and oxygen saturation. Obtain a 12-lead ECG within 10 minutes of arrival to check for ST elevation or other signs of ischemia. I would do continuous monitoring by placing the patient on continuous ECG monitoring to detect dynamic changes. Management measures include administering aspirin immediately, unless contraindicated. Sublingual nitroglycerin for pain, if not hypotensive. Oxygen, only if the patient is hypoxemic, SpO2 less than 90 to 93%, in respiratory distress, or has heart failure. Morphine, for severe, ongoing chest pain not relieved by nitrates. Establish IV access for potential urgent medications. In conclusion, I would treat it as potential acute coronary syndrome until ruled out. A patient with nasogastric tube begins vomiting. What should you check? I would check tube placement, patency, suction function, abdominal distension, and bowel sounds. I would notify the provider if obstruction is suspected. Question 4. You notice decreased urine output 20 milliliters per hour in a post-op patient. What is your action? I would focus on assessing for hypovolemia. Check vital signs for hypotension or tachycardia. Check for signs of dehydration such as dry mucous membranes or signs of fluid overload such as swelling in the legs, ankles, wrists, and face, along with rapid weight gain, high blood pressure, and shortness of breath. Then I would assess the surgical site. My next action is to check for bladder obstruction or bladder distension, especially if a Foley catheter is present and it may be kinked or clogged. My next action would be to check fluid status to review intraoperative fluid losses, estimated blood loss, EBL, and intake, output records. Notify provider immediately for further orders and likely administer an isotonic fluid bolus, for example normal saline or LR. Then review labs, which includes serum creatinine, blood urea nitrogen, and urine electrolytes if available, to check for acute kidney injury. Question 5. A confused patient keeps pulling out IV lines. What would you do? My immediate actions would be: prioritize non-restraint techniques such as securing the line with netting, dressings, or sleeves, using anti-pulling mittens. I would increase monitoring and consider consulting the team to switch to oral medications or HEP-LOCK if appropriate. Then I would check for underlying causes such as hypoxia, infection, or pain. Then implement safety measures such as reorientation, family presence, or sitter if needed. Next is to cover with clothing. Dress the patient in long-sleeved pajamas to conceal the tubing. Consider proper restraints, use soft limb restraints as a last resort and with proper documentation. Finally, re-evaluate the situation by continuously assessing if the IV line is still necessary. Remove it as soon as possible. Consider environmental adjustments to reduce environmental stimuli, which include reducing noise and light levels, ensuring personal comfort items are available. Then consider staff, family education to monitor for pulling behavior. Thank you and best of luck for your upcoming nursing interview.